Okay, I will go ahead and get started. Everyone is ready. Well, thank you for joining me on Facebook Live this evening. I have never done Facebook Live before, so please bear with me. Tonight's discussion is part of a series from the Healthiest State Initiative, Make It Okay, and Please Pass the Love. As you know, we are facing a global pandemic. Taking care of our mental health during this uncertain time is crucial to maintaining our overall wellness. So each Monday, a mental health professional will be hopping on to give you some tools and resources to help you do that. I'd like to thank everybody and thank you for Healthy Estate Initiative for inviting me to do this talk. My name is Dr. Ken McCann. I am my training and background. I am a child abuse pediatrician. I worked for 10 years at Blank Children's Hospital as the medical director of the Star Center. And as of March, I have changed from my clinical practice and started an organization called 100 Hands. So 100 Hands, our goal is to help healthcare systems who want to improve the patient experience, lower costs, and improve population health, but struggle with the effects of traumatic stress, both in patients and specifically focusing in clinician burnout, vicarious trauma, and staff turnover. But today, we're going to talk about talking to your children, communicating with your children about trauma. Please use the comments section to let me know if there's something that I would need to repeat or questions that you have. We'll talk for about 15, well, me, will talk for about 15 to 20 minutes. And then I'd love to have a discussion and do more discussing than talkifying. So, today we'll go over how to plan for difficult discussions with children. We'll talk about some of the trauma that your child might be facing at this time. Hi, Sunday. Isolation, media, worry, grief. Then we'll talk about self-care and go through some resources. So to start off, talking about planning ahead. How do we do that? How do we plan ahead for these conversations? Well, one thing to think about is when to have the conversation. Um, and there's two criteria I would really think about. One is in the past, when has your child been, comfortable talking to you about things? Has it been at the family dinner? Has it been going for a walk? Has it been in car rides? Oh, and speaking of which, I forgot to mention, um, there are other videos that I wanted to bring up that talk about some of these topics in much more depth. So some of these things I'm going to do a deep dive into. Some have been covered in more detail, and I'm just going to gloss over. So previous videos by Stephanie McFarland, Jennifer Yulee Wells, and Dr. Amy Shriver are definitely worth taking a look at if you haven't already. So planning the when. Uh, when can you, or when has your child been comfortable talking about things in the past? And when can you listen? So, when will you be able to turn off the cell phone? You're not doing dishes, you're not folding laundry, you're not, shopping online for groceries or things like that. So try to plan ahead, like what are the times that are good for a conversation? And remember that listening it really is a gift that we give others. When we are actively listening, when we are essentially, bearing witness to what they have to say, we are giving a gift to that person. And so when you're listening, put down your phone, put down all interruptions, yourself, and then when you're listening to your child, try not to interrupt. Focus on their body language. 90% of communication is through our body language. So, what is your child saying without saying the word? Ask clarifying questions to let your child know that you're participating in this and you're taking in what they have to tell you. And really be thankful for these moments. I say listening is a gift, but it's also a gift when others share their thoughts and concerns with us. And it's good to encourage your children to express their feelings. And I would say that some of the previous talks, especially the one about anxiety by Stephanie McFarland, is really helpful with that. And letting your children know that it's okay to be upset. It's okay to be sad. It's okay to cry. And children can express their feelings through talking, but there's many ways children can express people, people are some different adults, and children express how they feel. Writing, drawing, singing. There's many ways. So, one thing if you really want your child to express their feelings is an idea would be to open up several paths for them to be able to express how they feel. And with that, so just planning ahead, thinking about when can we talk about it, how will they express it, and letting them know it's okay to share their feelings. Next, I'd like to talk a little bit about the types of traumas your child might be going through at this time. And I would say the biggest one, not the, well, yeah, the biggest one in the sense that I think it's affecting the most people right now is isolation. And isolation is traumatic. It's traumatic isolation or trisolation. That's right. It's not a word. I just now made it a word. Trisolation. You heard it here first. So traumatic isolation. And why do I say that? Why am I putting so much emphasis on isolation? Because I think what is going on now is so against our nature as human beings. Most of us have grown up, when I would go out with my friends, my parents would always say, you all stick together. I tell my kids when they go out with their friends, stick together. There's safety in numbers. Stay with the group. Well, that has been completely turned around now. Now the groups are the danger, and we're alone in many ways. And so that I really believe that's having an impact on a lot of people. I would say most people, even us introverts, are starting to feel it. And for teens and young adults, this is especially difficult because remember these peer relationships, these peer milestones, going to prom, graduation, going to dances, recitals, plays, all these things are actually developmental milestones when you think about it. It's a transition period, just like saying the first word is a transition into being able to communicate or taking a first step when where children were little, or if you have little children, that's a transition to becoming, ambulatory and getting around and exploring the world more. Well, these peer relationships, these friendships that they've made, that's a building block to independence. That now, because of safety, teenagers are not able to take. And so I think we really need to be very mindful of things like them being upset because they can't, even hang out at the mall with their friends or something like that, because it is part of their developmental process. So I'll try to give some tips and tricks along the way, but so much of this we're figuring out as we go along. But for this, it may be helpful to, work with your children, with your teens to, have plans, have goals, even if it is something online or a virtual visit or a drive-by hello or something. Try to plan out what can they do to still have that participation and have some things to look forward to. Another source of stress can be media. And by that, I mean specifically graphic images, upsetting stories, things like that. And again, planning ahead is so key. And talking to children now about what they might hear or see, or what they've heard or what they've seen, and having that discussion with them. And if you're watching the news, watch it with your children, obviously, age appropriate. But especially for older kids and teens, sitting down and discussing what you're seeing together and what might be helpful. Um, since kids have so much access to electronics nowadays, and to the internet, is sort of that redirection. So just like, if you have toddlers or when your children were younger and they were going, towards the electrical outlet, which hopefully you had a plug over, but if it was one of the ones without a plug, you might redirect them to, hey, let's come over here and play with this, safe toy. We could do a similar type thing, and that's redirecting children to resources on the internet. So being proactive about, if you want to find out more about COVID, here, let's find some good websites. Healthychildren.org, the World Health Organization, um, CDC. Locally, our hospital systems have information on their websites, whether it's Unity Point, Blank, Broadlawns, Mercy One, et cetera, all have information about COVID. So helping them find safer, um, and by safer I mean, you know, places where they can find information without as much a risk of running across some graphic images or things that would be upsetting. And another thing is worry, and it's worry and anxiety. Again, those have been covered in detail in previous videos, which I recommend you watch if you can. But really, what I'm talking about is more specifically towards what's going on with COVID, and especially for children that have loved ones that work for healthcare systems, whether they are clinical or non-clinical work, but they're going into the hospitals, or they are first responders, or law enforcement, or social workers, all the high risk jobs right now. They're, the worry, the fear that a loved one will get sick. How do you address that? Well, some things that might help would be letting children know that these loved ones get special training on how to stay safe. Maybe planning ways to stay in touch. Maybe, you know, if mom works in a hospital, she can send a text over her lunch break or something like that. Just quick, hey, day's going good, love you, just to give the child that reassurance. And really also a reminder of the important work that their loved ones are doing. Another thing is, what if a family member has COVID, and now they are isolated? Maybe they're in the hospital. Explaining to children why this person needs to be away from the family at this time. And it's, that grandma, grandpa, aunt, uncle, cousin, whoever it is, neighbors, they're doing this to keep you safe. And again, providing what opportunities you can for communication, whether it's video, phone, letter, send get well notes for family members and get well cards. That can be helpful for not just the child, but for the person recovering. They Children may worry that a sick loved one is alone if they're in the hospital. And again, reiterating that, they are alone because they want to keep you safe. And letting children know, especially younger, well, really any children, that people in the hospital make sure that loved one is not alone. And again, and do video conference, cards, things like that. That will be helpful. Concern about death. Unfortunately, there is that is a reality that we are facing now in this country. And so children might be scared that a loved one may die. And be sure to give your child accurate information. I mean, certainly help them understand that most people are getting better, but be truthful and be honest about what's going on. Because unfortunately, like I said, that is a reality. And having those conversations openly and frankly is important right now. And unfortunately, people are dying. And if a loved one of your child um, dies, whether from COVID or from other causes, there could be anger right now. And the child might be angry because they may not have gotten a chance to say goodbye, or there may not be a funeral at this time because of social distancing and safety concerns. So, some things you can talk to your child about and work on is how do we share memories and feelings? Maybe we can do it virtually with other extended family members. Maybe within the members of the household, you can plan a memorial or a service um, for now, and then later, when it's safer, work on a funeral plan so that we can go through the mourning process. Have an object or a picture, something like that for the child, um, so that they can hold on to that connection with that person. And definitely assure your child that that person, he or she, you know, knew how special um, they were to you, that they know that you love them. And another thing, along with worry, is trying to see the good, because there is good within this. There are heroic actions and people doing amazing things. There are supportive communities. It's the Mr. Rogers quote of "Look for the helpers." Who are the helpers? And I think that's something that can be very helpful for your child is finding out, having your child help find who are the helpers, and what can your child do? Can your child be a helper? Can they make cards to go to residential centers? Can they make masks, like face masks? Even if you have a young child who makes a mask you're not actually going to use, like you really wouldn't use it, they can make the mask. Just don't let them find it in the recycle bin. But sure, you bet. Have them make masks for people. Around the house, one thing that might be helpful is because I do think there is this heightened anxiety is before you leave the house, tell the child that you're leaving and let the child know what you're doing and when you'll be back so that they aren't, left worrying, well, what just happened? Okay, mom or dad, they're going to the gas station just to put gas in the car and they'll be back in 20 minutes or something like that. So just so they know when you're leaving the house what the plan is. And this has been brought up in detail in previous talks, so I'm not going to go into too much detail. Again, I do recommend you watch those previous videos, but signs to watch out for. So sleep disorders, complaining of pain, behavioral problems, emotional distress. If you're starting to pick up on things like that, be sure to reach out to your primary care clinic, your mental health professionals, so that those things can be addressed. Next, I'd like to talk a little bit about self-care. And again, I know it's been talked about, but we're going to talk about it again because it's that important. And in Jennifer Yulee Wells's video, she said something that I thought was a great quote. And she said, "Self-care is self-preservation." And that is true. This is more than just, I think she had said, taking the bubble bath. This is much more than that. And now is the time really to be kind to yourself. And when previously I was talking about talking to your children, it's okay to feel, it's okay to be sad, it's okay to cry. That goes for you as well. It's okay for children to see you being sad. It's okay for children to see you cry. I would argue it's necessary. We have to walk the walk. Now, obviously, I would caution against showing intense emotions, as that might be, very scary for children. But showing your children authenticity is important. And then again, can't say it enough, staying healthy. Well balanced diet ish, exercise, drinking lots of water, sleeping, routines. And Dr. Shriver's video, she talks a lot about routines and the 7 C's of resiliency. So I do recommend watching that. And when it comes to resources, there is something I used to give when I was in clinical practice. I would give this out to parents that had young children. And it's just an index card. And I would say, take this card and write down the names of 3 people you can call if, in the case of a newborn, the baby is just nonstop crying, or if you need help picking up something from, in this case, maybe, getting something from the store, or, drive-by pickup or something like that from the store. Or if you just need someone to talk to, who are 3 people you can reach out to? And then take this card and put it somewhere where you see it every day. So a refrigerator, a mirror, a door, somewhere where every time you pass by it, you can look and say, this is my go-to team. And it doesn't have to be a card. It can be a scrap of paper or a post-it note or something like that. But I do recommend doing that. And along with that, I do have, and I'm going to put up on the screen here, just some other resources that some people may want to just take a look at and just see that could be available in their community if they were to need it. So I'm just going to leave this up here for a second if anyone wants to write down any of these resources. And then next, there are some books that are very helpful. One is a little bit more general. It's called "How to Talk So Kids Will Listen and Listen So Kids Will Talk." The next one is a little bit more specific for children who've experienced trauma. And the foster care clinic at Blank, their therapists use this quite a bit for foster parents and and relative caregivers. And it's called Integrative Parenting: Strategies for Raising Children Affected by Attachment Trauma. So those are both wonderful resources. And having said that, I think I will open it up for questions or comments. Thank you. I don't know if anyone? Bueller? Bueller? Okay. Right. Let's see. Oh, okay. I may have to scroll up, see questions, and I don't see a scroll. I knew that was going too smoothly. Let me see. I'm going to ask my technical support person that's in on this where I go to find questions. Oh, she's sending me questions. Thank you. Oh, there. No, that's not it. I apologize, guys. Okay. All right. How to reassure teens who are isolated from girlfriends and boyfriends. And again, it's part of that connection. And I think the reassurance may come into the maybe part of just letting them know this is not going to last forever, right? I mean, this will pass. We're going to get through this. And maybe for um, something like that, you could even say, um, what sort of activities would you guys have, planned once we get through this? Um, going for walks or going out to certain restaurant to eat or things like that. And again, trying to plan for the future because I think we all have to have something um, something to be planning for. And what to do with angry and what to do with angry and hurtful kiddo? Well, certainly, if your child is angry, is hurtful, one thing I recommend, with the caveat that I am not a therapist or a psychologist, but I do think connecting with your child, acknowledging that anger, recognizing it and validating the feeling. Now, I don't mean validating, if they're hurtful, if you mean physically, hitting, throwing, kicking, things like that, but validating, yes, you feel angry. It's the what therapists and social workers will call name it to tame it. So recognizing that anger, and if it really is, to a point that is distressing, reaching out again to your primary care clinic, your therapist's office, or have them refer you to a therapist's office, and certainly the mental health resources in your community to start working on addressing the roots of that anger. Hopefully that helps. But yes, just validating the feeling, I would say, is the low hanging fruit. That's the one thing you can do in that moment. All right, let's see here. How to help us as parents who are grieving missing milestones like graduation. So, as parents that have missed out on this because, you've worked hard to get your children to the graduation, the prom, all these different milestones. I think really the best way to help you is to say it's okay to grieve. It's okay to be sad. It's okay to be upset that you're missing those things. And kind of like the angry, hurtful kiddo, I would recommend, if you have somebody outside of your circle of support systems, but somebody either through your primary care office, or um, your, therapy clinic, mental health resources? Who do you have that you can talk to about that? And it kind of goes back to that card of who are the three people you can count on. And, friends and family are great for support, to be there to help hold each other up. But really, things like the feelings of grief and loss, I do recommend, it's helpful to have someone, a professional, who can help you process those feelings. All right, let's see here. When should we start allowing interactions between kids and friends? And if we do, what parameters? I don't know the answer to that one. I'll be honest. I don't know how to answer that at this time. I would love for kids to be able to have more interaction, but they need to be able to do it safely. And I just honestly don't know what that looks like. I would keep checking in with your healthcare systems, with your primary care office, reading here in Polk County Public Health, your public health departments are going to have information and resources for you on that. But unfortunately, I don't have the answer at this time, and I wish I did. Okay. Tips for parents of children of special needs or small children whose routines are out of whack. Any good resources or songs? Oh, you don't want to hear me sing, trust me. But for children with special needs, I would say some things that can be helpful is certainly when you're talking about traumatic events, communicating traumatic events. Um, it, well, let me back up. It kind of depends on what the special need is. But for example, if you're talking about trauma with your child, be sure to talk at the developmental level of your child, not their chronologic level, which I know is preaching to the choir. You're doing it all the time. Just a reminder, this is not different. That you would want to speak to them at the level they're at. So if you have a 16-year-old who is developmentally 8, well, 8 would be your target of how you would discuss things with your child. Some other special needs considerations might be, especially children with who have ASD, autism spectrum, um, that the routines are so key. And yes, it's tough for anyone to have their routines out of whack. I feel like it's especially tough for special needs children to have their routines out of whack. So certainly doing what you can to get those routines back in place, as much predictability as possible. And I would also recommend, if you haven't seen, again, Amy Shriver has a video on this course about routines in children. One other thing, as far as routines, that I was thinking about is children who have sensory integration issues, and some of the comfort things that we typically do, like hugging or pulling a child close, being mindful. For some children, that may be too much. For some children, they may need more of that. Their daily routines, from a sensory diet standpoint, might need to be adjusted. So keeping an eye on, are they getting sensory overload, or are they not sensory stimulated enough, and adjusting routines for that. Okay, someone had asked how to talk to kids about the fear of dying. Um, so, uh, you know, if we're talking about, the fear of dying for, fear of a family member, again, reassuring them, that, most people are recovering from COVID, but again, being realistic with them about what is going on with that particular older person, if it is a loved one and there is a poor prognosis, um, do not try to sugarcoat it. I mean, certainly you want to, be as mindful to their developmental level, but be as truthful as you can. As far as talking to younger children, um, I think a big thing would be to try to talk about, yes, there are always risks, but here are some things we can do to stay healthy. Here are some things we can do to help others stay healthy. And certainly, discuss it, but again, being having that approach of here are things that can be done, that help, and letting them be helpers. Like Mr. Rogers said, look for the helpers. Let your children, be helpers with some of those things. All right. It looks like that is all the questions in the comment section. So again, I want to thank you for joining me on Facebook Live this evening. Tune in next Monday for another discussion on mental health. And for more resources on how to support you and your family's mental health during this time, you can visit makeitokay.org. I'm sorry, makeitokay.org /Iowa, or please passthelove.org. Thank you again and have a great evening.